My name is Adrian Nantchev, and this channel is all about helping you become a remarkable entrepreneur. Today I have with me an interesting guest, a returning guest actually, Brennen Hodge, all the way from Mississippi, to talk about health and disrupting the health industry in the States. Because everyone knows that health is top priority, life expectancy, diet, cholesterol, stuff like that, other buzzwords and keywords. But everyone knows there's some fundamental issue in the status quo. And one thing I learned ages ago, a little secret, is the route to success is disrupt, change the status quo. So Brennan, please tell the world, what are you doing and why? What's changed since we last spoke?
Sure. Well, first of all, thanks, Adrian, for having me back on here. It was a pleasure to come back and expand on our original conversation. So to kind of get into what we are doing now, we are trying to disrupt healthcare in America. And for all you listeners out there, if you're familiar with America's healthcare system, people say it's broken, but I think it's working just as designed. It was just designed incorrectly from the very beginning. It's just taken us about 80 years to figure this one out. And the problem is having insurance intermediaries in the middle. We don't have a single payer system here. We have about 600 different payers, and each one of those payers like to take a lot of money from the people, the citizens, and give the doctors and the hospitals very little. A lot of stuff on both sides. Patients, the important parts of being a patient and what they need, they don't get because you have an insurance company trying to take every dollar they can away from them. So there's a problem. So what we're trying to do is step in and look at the patients and look at the doctors and also look at the care providers around them and redesign healthcare around those entities where we put people above profit. And when you take out the profit motive, you allow a lot of things to happen, especially when you remove these intermediaries, such as insurance companies, and have a direct connection amongst the patients and the providers. You create a free market healthcare system. And that is what I want to talk about a little bit to begin with, is this free marketplace that we have created. It's called Medoplex, still kind of working on that name, but I believe it's sound for what we're trying to do. This is the kind of the catchphrase is we are building the marketplace for a free market healthcare system. And there's been a big push lately for free market systems, open systems, free market system, whatever you want to call that, where people can buy and sell without government regulation saying you should do this, you should do that, or having large intermediaries in there saying, no, you can't do this or can't do that. Have it completely open, free market capitalism, if you will. And that is what we're doing with the Medoplex. We've created a unique marketplace, almost like Amazon for healthcare, where healthcare buyers can directly contract and transact with healthcare sellers. And now the healthcare buyers are the families, the individuals, the employers, self-funded employers, and governments, people that are paying for a solution to their healthcare problems, whether that could be a messed up knee, you need back surgery, or you just need to see a doctor just for a checkup. You have a problem and you're looking for a solution. And the healthcare sellers are the ones on the other side of the marketplace, the ones that sell their services or sell their solutions to the healthcare buyer that has a problem. Now, these are general terms, healthcare buyer and seller. A lot of doctors don't like to be called a healthcare seller, but if you break it down to economic terms, that's what you're doing. And these healthcare sellers now, they can offer their services, whether that be a 30-day primary care subscription, or a annual subscription, or a back surgery, or a knee surgery, or a physical therapy session, or whatever that may be. They can now offer their services on this marketplace. And just like you go on Amazon to search for whatever you might search for, you have certain criteria, certain filters you might want to search by: ratings, reputation, price for one, whatever you deem valuable. And these healthcare direct healthcare sellers out with insurance. So that sounds great, but if you break it down a little bit further, which I'm doing here shortly, you'll understand that there is tremendous value in this. And let's review what they have to deal with. Doctors in America, they have to bill everything they do. Let's just say one patient comes in here and they have the flu. You have to document everything according to what the insurance company or your hospital administrator wants you to document for the purpose of billing this insurance company. So you're spending a lot of time on a computer system, EMR, electronic medical record, to make sure you insurance correctly. On average, doctors spend about 40 to 50% of their day doing this type of mundane work. Really, it's not relevant work to treating the patient. It's really for the hospital administrators and for the purpose of billing. So from their point of view, having to deal with insurance is a headache. For one, you don't get paid automatically. You might not even get paid at all. You have to send a claim out to the insurance company, and you're going to wait 60 to 90 to 120 days to even get paid. And it's a very crazy process, because you might bill, let's just say a knee surgery, you might bill for $50,000, and the insurance company says, no, we're only going to pay you $17,000, and that's what you got to accept. So if you really look into the actual transmissions of all these things, all these claims, it's ugly and it doesn't make any sense. It's not logical. It doesn't make common sense. So looking back at this doctor point of view, now we've created this way where doctors can tokenize their health offerings. Now I'm going to get into some cryptocurrency side of this, but since we are building on top of the Ethereum blockchain, public blockchain, we're using these new things called ERC 721 standard tokens. And everything up until this point has been ERC 20 tokens. Ethereum is the ERC 20 token, and the thousands of other tokens that have been issued on this the Ethereum blockchain with these smart contracts have been all fungible. Meaning, if I have 10 ether and I give you 10 ether, Adrian, it's still not the same 10 ether, but it's still 10 for 10. If somebody else has 10 ether, you can exchange those, and there's still 10 ether. But if you look into this new standard 721, they create non-fungible tokens, and that is amazing. This actually brings to life the promise of blockchain. We're using an example here, but let's just say this is one unique asset that I own, and this represents a complete knee surgery, complete knee replacement surgery. And in this, there are certain terms and conditions that's programmed saying this is a knee surgery good for 365 days, and you can get this knee surgery at this hospital center with this surgeon. You can get all the anesthesia that goes with that. You can get pre-op, post-op care. You also get the knee brace that goes with that, and you get all your physical therapy care. And this is lumped into one payment. So now you have this token, this tokenized health offering that me as a physician, I might go into partners with the anesthesia group, because we have to have anesthesia, with the physical therapy group, and with the hospital system, surgery center, because of course we got to use their equipment. And you can bundle it up into one offering. And you put that offering on an exchange, just like Amazon. Imagine you're on Amazon searching for a complete knee replacement surgery. And as a healthcare buyer, let's just say, for example, I'm a self-funded employer, and I say that, I want to save money by purchasing a bundle episode of care. So I go in there and I search for, whatever reputation, whatever value that I'm looking for, and I find that there's a bundled offering of care here for $17,000. And what I do is I purchase that directly. Okay, now I have one token, one ERC 721 token that represents a complete knee replacement surgery. And let's just say that I own a large company that has, on average, 20 knee surgeries a year. Okay, so I can pretty much predict what's going to happen the next year. So I might go there, and at the beginning of the year, I'm going to purchase 20 of these things at $17,000 a pop. Well, halfway through the year, I've only used 10% of this, and I realize that I'm not going to use the rest of these knee surgeries. Luckily, my employees haven't had knee problems, so now I'm stuck with all these. So what do? I sell them back on the marketplace. I put them up for sale because they are a token. Just like any token you trade, you can put it up for sale. So I put this up for sale back on the marketplace, and I sell this to another employer that needs, or an individual that needs a knee surgery. for this price, because since we're prepaying this, you're buying in bulk, you can get a better discount, almost like a Groupon model. You think about with large retailers, you can, as a self-funded employer, you can connect with other self-funded employers and purchase in bulk from these surgery centers or from individual doctors, whatever that may look like. The point I'm trying to get at is this is very flexible. And now that you can have an option to purchase these up front, these surgeries, these tokenized health offerings, you can program different things into it, such as what I mentioned. This is good for 365 days. This is only redeemable at a certain place. Likewise, you can, anything you can imagine in terms of some terms and conditions that you might want to apply to the offering that you're offering as a healthcare seller, you can put into this. And it's a beautiful thing because it enables that free market system to take place. Meaning, if you're an employer or if you're a government, you can directly contract, if you will, with these hospital systems, these surgery centers, these individual physicians, and you can transact for a much lower cost than dealing with insurance because you're just doing it directly. And everything is built into this token, which is built in by the protocol we're developing. So I know I kind of got off topic on where we're at, but that's the underlying mechanisms of this Medoplex that we're building.
Yeah, a lot of interesting stuff just there, Brennen. But one thing, going back a little bit, you said when you disconnect the profit motive and put people first of a profit, why? So I'd have thought if you put profit first, you inadvertently put people first as well.
Not here, not what we're doing in America, because with insurance, okay, this is the insurance business model.
Mm-hmm.
Let's just, I'm going to point out, I'm not going to point at any individual insurance companies, but their business model is to take as much money as they can from the American people in terms of premiums, which if you look at it, we paid about $1.2 trillion in premiums last year. And that goes to various insurance companies, but over 600. And their business model is to pay doctors as little as possible so they can keep as much money as possible so they can make a higher profit. So now they're causing us to pay more, and their business model is to give us less, because if they give us more, if they cover everything, that means they have less profit. So their profit motive, since they're driven by profit, they're more apt to say, no, this patient does not need this liver transplant because it's going to cost us too much. And they let that patient die, which just happened. There's a big uproar right now because insurance company denied this liver transplant and this person died just because it's going to cost too much and their profits are going to be cut. Okay, that's what I mean by removing that profit motive, because you're having these insurance companies, these corporations dictating the health of patients. They're dictating what a doctor can and can't do. Well, we're just connecting the patient and the doctor and letting them practice medicine just like they want to. We don't need this corporation dictating on, okay, it's not going to be profitable if you do this, so don't do it. So now there's still a profit motive in there from the physician side of it, not the insurance side of it.
But my other concern then is, because it's on a marketplace and you can buy these like tokenized operations, really, couldn't a whale come along and just buy up all the common cold flu injections or certain small procedures in a certain area and not flog them and not sell them unless it's for a higher price, you know? Like a quasi-insurance company, so to speak, almost. Couldn't they? Couldn't someone do that?
Yeah, no, that's a great point. Great point.
Yeah, can you hear me still? It seems a bit of a dodgy connection. Brennen?
You kind of broke up on that last point, but I heard the beginning of it. That's a great point. This basically go in there, they purchase up all these surgeries and procedures, and they turn around and resell them back to people.
Mm-hmm.
Yeah, you're breaking up.
Yeah, you're breaking up a little bit as well. But how would you curb against that? How do you hedge against that? Any ideas?
Yeah, you're breaking in and out.
Oh, okay. I'm not sure why. But yeah, it's a bit better now. But yeah, so how could you curb against that? How
Yeah,
could you hedge against it?
you're breaking in and out.
But how do you avoid that? How do you avoid that? Someone buying all the procedures. Okay, yeah. I'm not sure what happened just there, Brennan. But yeah, can you hear me now, Brennan?
Adrian?
Yeah, so he was saying what I was saying. How could you avoid prevent someone from just buying up all the simple
I can
procedures?
hear you now.
Yeah, how do you curb against that?
I can't hear you. Freezing
Right.
up.
Okay, hold on a moment.
It looks good now.
Yeah, awesome. I'm not sure what's happened there, but yeah, how do you curb against it? How do you stop someone from buying all the simple procedures?
Yeah. Great question. If you look at insurance now, that's essentially what they do. They go to these a geographic area physicians and then go and purchase up all their time, basically, and they repurpose or repackage that in the form of premiums, and they sell those prepaid services back to the American people, and they take their margin off the top of that. We have what I talked about, expirable services. So these tokens, let's just say, for instance, this knee surgery, let's just say it's $20,000. So it starts off as that doctor's willing to do this for $20,000. Well, it makes sense. You go there and say, I'm going to buy up every single surgery this doctor can potentially do because I know he's a good doctor. I'm going to turn around and sell $25,000. Great question, but that is not coded into our protocol because it's an expirable token. It has a time window that it can be redeemed. So it's just like if you look at the financial world where you have options and you basically that time value, the premium is, I say premium, but the price is actually decreasing as you get closer to that expiration window. So you can't just purchase up 100 of these surgeries and expect to flip them because if you hold these things, they're actually decreasing in value, if you will. So that eliminates people from buying in bulk and turn around and trying to double the price because they're actually, since it has a time value, it's constantly decreasing down to the very last day. So there's really no benefit. There's no incentive for somebody to purchase these and turn around and resell them because they are decreasing. And likewise, at the same time, these physicians, they can see that. They can see that, okay, somebody else is trying to resell these tokens, which, since you are talking about this ERC 721 token standard, somebody could theoretically try to offer it for a higher price, which that happens on marketplaces all the time. But if that physician sees that, they can also say, well, I'll just go ahead and create 20 more tokens or 20 more surgeries at that $20 price point. Why is somebody going to pay $20,000 and going to pay $20,000?
Yeah, I see your point. Interesting. Yeah, but what? Can you not hear me? Can you hear me still, Brendan?
You're breaking in and out.
Yeah.
Yeah, you're breaking in and out.
Okay. Well, that's interesting because that way you're rewarding almost those that need the emergency, need operation at an emergency or a short notice, which is an interesting little concept. And with regards to the whole network, the Medoplex, what's the timeline on that? What's happening there?
Timeline? I'm expecting to have this done by the end of this year and probably piloting it with surgery centers by the end of this year or beginning of 2019. And we've built a lot of the infrastructure already. Since we've been working on this last time we've talked, we built a lot of our protocols, our Medit protocols, our proof of health algorithms, developing our mobile app that will serve as a personal health record. So we're building the infrastructure to build on top of. But also with this marketplace, you're going to need software or interfaces on the healthcare buyer side, us purchasing healthcare, and then the physician side. So we're now starting to begin to develop the systems on both sides. And you're looking at, it's robust systems because you look into healthcare, there's so many different things that you can offer. And there's so many different scenarios that healthcare buyers, for one, self-funded employers need to purchase. So we're going to focus on surgeries first, which is pretty cut and dry. You can have a bundled, complex episode of care, and we're also going to focus on direct primary care. That's kind of both ends of the spectrum. Surgery is very costly, I guess, and very rare if you really look at the terms of surgeries that do need to happen. But if you look at direct primary care, we're focusing on these physicians first because they are pushing the movement for free market healthcare. And we want to offer subscriptions to their services. So a way for them to offer their subscriptions to anybody that wants to subscribe, almost like Netflix, if you will, to their services. So you can pay a primary care doctor $70 a month, $100 a month, whatever they're asking, and that will be available in this marketplace. So that will be in effect starting January of 2019. Interesting.
Yeah, it seems that a lot of businesses that went crazy in the boom, the past, back in December, November, and all the rest, that they're all coming to maturity now. They're all starting to launch and be actually active in the ecosystem and in the world. I know a few of the platforms that are launching in this summer, and the fact this one's going to launch by the end of the year, it's quite indicative of where the whole ecosystem is going as a whole. All the blockchain technology, all the coins, all the ICOs, where it's going to go. Even stuff like STO, securitized token offerings on the SEC and the actual stock exchange. Very interesting. You mentioned that. But also, there's something else I want to mention quickly. Tokenization. Yeah. One thing I was curious about. You said that you could mine it by exercising. How would the software tell if you're exercising, say you're walking on a treadmill compared to walking in real life in the world? Because something like that is something I would use, especially when going to the gym.
Mm-hmm. Yeah, awesome. We have our first consumer app that's coming out called Humantive. It should be live and probably in beta testing mode, probably in about a month, end of this month. And what we do with that is we have an app that connects fitness data, Fitbit data, Apple Watches, various Garmin, other wearable products, stuff like this, like a digital wireless blood pressure cuff, wireless scales, kind of going down the list. And we also can import your medical records from EMRs, from various EMRs that you can access online, and also your genetic data. So we're really building a complete holistic view of your health at a given time and over time. So from that, we've developed a proof of health algorithm, which, if you're familiar with Bitcoin or Ethereum, currently it's a proof of work algorithm that you're basically proving that these machines, these nodes in the network, did this work. That actually they completed these computational algorithms. They solved this math problem, if you will, and they are rewarded a unit of value, say Bitcoin in this situation, for doing that work. Well, we've created a proof of health algorithm, which we're proving that you are doing things to become healthy, whether that is walking, getting proper sleep at night. I mean, you're getting paid to go to sleep. That's elevators. Most or all of this can be done through your phone. I mean, there's so many different
very powerful
that you have a little mini computer, mini medical device with you at all times. Most people do, and it's so you can determine. Now, you're talking about walking outside or walking on the treadmill. Same thing. You're still walking. You are still burning calories. You are still pursuing a healthy lifestyle. So anything like that, there's so many different data points that we're measuring, but we're starting off easy. We're taking steps, daily steps, elevation change. You take the stairs versus the elevator, and sleep and blood pressure and weight. We're just looking at those and see how those change and fluctuate over time. And you are rewarded with cryptocurrency or Medit token based on the increases in that. So it's going to be changing as far as what the challenges we have. We have ideas on having social challenges where it might be, that 10,000 step day, like tomorrow. The goal is, as a community at large, to go take 10,000 steps. So imagine if you can motivate everybody in the world at the time that's using this app to go take 10,000 steps. Just the health of the population should go up theoretically. You go walk, we should be healthier, and that's what we're trying to do, is stimulate some behavioral change, because financially motivating somebody to do something works. If somebody pays me to go walk, I'm going to go walk. You know, it's most people will do that. And there's multiple apps out there that are doing something similar, paying people to walk, and people absolutely love it. I've read comments where people said, you know, I used to be a couch potato. I sit there and watch TV all day, but then I started being able to get paid to go walk, and they do it, and it's changed their lives. So we're looking at that, but we're taking it much further than walking. You're looking at your diet, your nutrition, your fitness activities, and you start taking in the whole social determinants of health. You can really encompass your health as an individual, your personal health record, and we can set plans for you, whether you want to be an Olympian athlete or whether you want to be health journeys, we're calling it, personal health journeys. So it's a very unique app that is designed to motivate people to be healthier. And, you know, you talked about being a miner. Each individual person essentially turns into their own miner because they are a node in this network. It's not necessarily proof of work, but we are proving that you are pursuing a healthy lifestyle and you're getting rewarded for that.
Yeah, sounds very interesting. I like that a lot. I use an app called JetFit. Would it work with that one?
Still there, Adrian?
Yeah, would it work with JetFit? You mentioned Fitbit.
Say that one more time.
JetFit. I got an app that's called JetFit. Would it work with that one? Well, not yet. JetFit at all. You mentioned Fitbit. Would it work with JetFit? I can hear you.
With JetFit?
Yeah. Does that sound familiar? An app.
JetFit? No, let me check it out.
Yeah.
So,
yeah. Well, the thing is, would this work for people outside the States? Because you mentioned the EMRs, the database. Unless you're connected to NHS, I'm not too sure how you can get that kind of data over here.
We do plan on doing that. For one, we're working with, there's about 30 different wearable devices that we are working with on Fitbit, Garmin, and Apple Watch is really the top three that we found here in the States. But we're open for anything. Any company has an open API that we can connect data to or connect to and get data from. We're open for that. This is the first time I've heard about it, but we'll definitely look into this. Interesting. I like this app.
Fitbit, we'll look into that as well, see what that's all about. And it sounds like, I see. Oh, okay, yeah. Okay, yeah. It seems very much like you're tokenizing health data through the Internet of Things. I like that. Very creative. I like that. Oh, that's really cool. But unless there's anything specific you want to mention, or name drop or link, anything you want to mention?
I do, while we're here having this conversation, I would like to talk about what we currently have going on. We're not having a traditional ICO, initial coin offering like in the past, because in America, that is kind of viewed by the SEC, our regulatory body, that these tokens are securities. And we want to follow the law and not go to jail. So we decided to do a
you're breaking up a little bit, I think. Follow the law, decide to do something else.
We have we're selling our token. So we are raising funds that way. Crowdfunding. It's like Kickstarter, but in equity. You're not donating money or purchasing a product, you're actually purchasing equity. And we have created one of the world's first security tokens offerings. There's probably like 10 or 15 of them now, but I would still consider that one of the first. And what this token represents is equity in our company. It's a security token registered with the SEC, and you get a right to vote. You get a right to future dividends, if we do decide on that. And there's other staking mechanisms with this that we can talk about, but that's kind of later on. So it's a unique way of having equity in a company. And right now, that's going to be going on for about another 40 days. So if anybody wants to participate, you can go to our website, citizenhealth.io, and click on crowd sell, and you'll be taken to a registered platform called Start Engine, startengine.com, and you can find us there. That's a pretty neat platform too. If you want to look at any other investment opportunities, they have a lot there.
Oh yeah, Start Engine. Oh yeah, interesting. Check it out later on. Check it out. Well, awesome. But Brennan, it was great having you on the show. I'm definitely going to look into this in the future. Looks like some very interesting and cool ways to monetize, well, go to the gym at the very least. Awesome. But Brennan, thanks a lot for coming on the show.
All right.
Cool.
Thanks, Adrian.
And remember, ladies and gentlemen at home, if you haven't already, subscribe, comment below, because this channel is all about helping you become remarkable. And you see, that is what life is all about. Going out there today and doing something remarkable with your life, because that is what life is all about. How cool is that?